Over the past 20 years, Princess Margaret Cancer Centre has become more ambitious. We are more ambitious for our patients, for ourselves. We have more of a sense of urgency. We want to create the future. We want to provide tomorrow's treatments for patients. We want to be the best. We have grown our research programs tremendously, both clinical and basic and translational. And we've also had tremendous growth in the programs and facilities for our patients. So it's this sense of urgency and ambition to provide the best possible future for our patients that has been, to me, the most wonderful thing that happened. Raised the bar.
Well, that's an impossible question to ask because there's so many things that have changed. Take, for example, information. Back in '95, we actually had the tools to analyze the amount of information we had because we had so little information. Now, with the information we have to hire researchers that do research in how to analyze information. Take precision. Back in '95, we didn't have the kind of tools that can help our surgeons and the radiation therapists deliver their treatments with precision. Now we're leading the world. Take biomarkers. Back in '95, we had a few genes that were slowly coming online that we knew could cause cancer. Now we're looking at thousands of genes in thousands of patients on a routine basis. There's tons of things have changed.
So I think one of the most truly astonishing changes has been the technological innovation in the delivery of radiation therapy. The story could be told through these colored crayons. We were taught to use these colored crayons and to draw straight lines on patients' X-ray films of where we were treating whatever the target might be, the head and neck, lung cancer, and what have you. We also used to have several different colored pencils. So you'd have the blue color, the yellow, the red colors, and we'd be carrying them in our lap pockets. So it looked incredibly geeky. And so that was the way things that were done about 25 plus years ago. And then in the late 1990s and the 2000s, we ushered in the era of IMRT, or intensively modulated radiation therapy. And so then we became, and we landed now into a transitioned digital era. The prescriptions became electronic. The doses were delivered using digital technology. So to me, this has been just absolutely astonishing and spectacular, something that I would never have imagined when I started practicing more than 20 years ago.
So since I've started working at Princess Margaret, I've really noticed the nursing role evolve here. There's much more education, lots of resources put in place that are really empowering nurses to succeed in their roles.
So surgery has undergone tremendous progress over the years, and in particular at the Princess Margaret Cancer Centre, we've seen great strides in innovation. I think currently we're performing excellent surgery, and what's important is we've gone towards a minimally invasive approach. The premise of surgery is to obviously remove the tumor in its entirety, but what we've realized over the years is there's a lot of collateral damage. So when I look forward and I see where the field is moving, I see it moving towards a more precise type of surgery where we're individualizing care, and really looking into the future would be an overlaying of imaging and functional imaging in particular. I think the Princess Margaret Cancer Centre is positioned to lead the way in this area.
One of the things I've really noticed and I've had the privilege to be part of is that with all of the advances in cancer care and the increasing demands for patients to take on a more active role in their health, Princess Margaret has really responded by creating spaces where patients and families can get the information that they need to participate in their care as they're needed. And at the same time that this was happening at the hospital level, it's also happening at the patient and family level, where they are also increasingly interested in having more information and participating more in their care. And sort of spaces like the Princess Margaret Patient and Family Library and like Elixir really offer a lot of opportunities for patients and families to get the information that they need.
I've seen a lot of impressive improvements over the last 20 years. We've seen a lot of improvements in the breast cancer arena specifically. New drugs such as Herceptin have really increased the survival rates, and there are new targeted therapies coming up every day. We've seen radiation therapy improvements in precision and giving radiation to the right people with less side effects. We've got the Gattuso Rapid Diagnostic Clinic, which can see women with a breast problem and diagnose their problem within the same day. One really impressive part of what I've seen really changed what was then the Princess Margaret Hospital to what is now the Princess Margaret Cancer Centre. And that's the incorporation of surgical oncology into the cancer program's fabric. And this evolution has really changed the way we treat patients in a multidisciplinary fashion. The union is really much more than the sum of its parts. I've seen this 20-year evolution happen, and I'm really looking forward to the next 20 years.
I think that we've really started driving proactively a mechanism to look for international collaborations and partnerships, particularly outreach programs. I think that 20 years ago, I think many of our faculty had very good academic traction and were known nationally and internationally. I think that over the last few years, we've tried and in fact look at this in a much more structured way and develop collaborations and partnerships that make sense. These international collaborations have come in, I guess, 3 different shapes and sizes. The first one are academic collaborations that individual physicians have had based on their research and academic interests. I think that continues to be very, very strong. In addition to that, I think that Princess Margaret and UHN have also started engaging in consulting collaborations, particularly with Kuwait and Qatar. But in addition to that, we've started developing institution-to-institution collaborations with many different centers that are also looking for international collaborations on a win-win basis. And I think that we've developed some very interesting collaborations with institutions like the Tata Memorial Hospital in Mumbai. We've developed a collaboration with the King Hussein Cancer Centre in Jordan. We've developed a collaboration with Valdehebron in Barcelona. And these collaborations are academic institution-to-institution collaborations and will form the foundation of longer-term center-to-center collaborations, which may involve research and teaching and education.
I think what has struck me over the course of 20 years is what hasn't changed. You know, that passion, that dedication, that personal touch with the patient, I think has been as strong today, or is as strong today as it was 20 years ago. And I think that that is a measure of the resilience of our staff to really be dedicated to the care of our patients.